just so I can check your levels, can I get your full name, please, and your role?
Yeah, so I'm Jeremy Rushmer, and I'm the Medical Director at Northumbria Healthcare.
That's fantastic. Now, 1 year on from the hospital in Cramlington opening, can you tell us a bit about your successes and challenges, just a brief outlook on what you're thinking so far?
Well, I think it's been a very, very good year. It's been a year that has been unprecedented in terms of the number of patients that we've seen and treated. And what's absolutely clear is that the doctors, nurses and patients really like the model of care that we've put in, which gives us faster access to diagnostic and specialist care, which allows us to turn patients around and see and treat them much quicker than before. It's been really good for the health economy. We've managed to discharge home without admitting more patients than ever before. So despite the fact that we've had more patients coming to our new hospital, we've actually managed to admit less of them.
Now, one of the main challenges is the handover time with the ambulances. Can you tell us a bit about that?
Yes. So what we've done is we've moved from 3 ambulance queues at our 3 previous sites down to 1. So there's now 1 single queue. So all of the problems that we've had with our being so busy have become very, very much more visible. But what's gone on has been an unprecedented year for the NHS, where more and more people have been attending our A&E. There's been, over the year, 15% more people coming to our A&E at Cramlington, and we're now, by far and away, we see more ambulances than any other trust in the region. And what that's meant is that they've been queuing to get into our A&E, and we've had to be working very hard with our teams to try and manage that queue of patients.
Now, can you tell us what this handover is and why we have a 15-minute standard?
Yeah, so obviously you'd normally expect that people who come in by ambulance will include quite a high proportion of people who are seriously unwell. So and they'll be assessed by the paramedic crews who are with them, but they will very quickly need to give a handover to the clinical team so that we can carry on the care that they need. So the quicker we can do that, the better.
Now, I know that you've had an extremely busy time, especially at the beginning of this year, January, February, March. There was more than 20 days worth of waiting time in these queues outside the hospital in March. What's the risk there? Why is that a worry?
Well, it's a worry because what I would like to assure you is that we do prioritise and see and treat all of the patients who need to be treated acutely, but we do then need to turn the ambulances around to have the ambulances prepared to go back out onto the road. So obviously when they're waiting, even if there is reduced clinical risk because we know that patient is safe, it does mean that they can't be out there going and receiving other patients.
Now, it's something that we're seeing right across the region, right across the country. When you have these periods of high demand, is it felt most obviously when you've turned 3 queues into 1 here at Cramlington?
Well, I think it's much more visible by turning. I don't think it's longer because we've turned 3 queues into 1. I think the reason it's bigger is actually because of the success of this fantastic new hospital that's proving to be much, much more popular. So we're now getting a very high proportion of all the ambulance journeys are now coming to the Northumbria. It's very well connected to the northeast road networks, and so it's that unprecedented demand with an extra 3,500 patients attending to us in March this year, a 15% rise over the whole year, and a 24% rise in attendances at A&E in March alone. It just really shows the scale of the demand that we're dealing with.
So how are you hoping to face these challenges moving forward then?
So we work very, very closely with our partners, and every day, every month, every week, we're always working with new ideas to try and improve the queues. So we're making it possible for ambulances to deliver to other locations within our hospital. We're making doctors and nurses available to speak to the ambulance crews to help them with what they're doing. And I know that North East Ambulance Services are working with a see and treat model to try and prevent unnecessary ambulance journeys.
And looking at the figures in March, I think it was more than half that were red calls, so life-threatening, but it seems that that isn't the case when people get to hospital. Can you tell us a bit more about that?
Well, obviously I'm not an expert, but the calls are triaged by the ambulance service on the telephone before they've seen patients. What I can tell you is that by the time the patients come to see us, of the people who arrive by ambulance, approximately half of them are not admitted to hospital, and we are able to send them home. That doesn't mean to say they don't need to see a doctor or a nurse, but it does mean to say that they aren't seriously enough ill or injured to require an admission to hospital. And that's part of the problem we're dealing with as a health economy.
So considering that, would you say that you are struggling and maybe a reduction in this could help?
I wouldn't like to describe what's going on at the Northumbria as struggling. I think actually it's a challenge, and clearly a lot of people are wanting to come and access our services. I think there is a challenge for the whole of the NHS to try and get people seen in the very, very best location that we can. We're one of the national vanguards where we work with North East Ambulance Service and our colleagues in primary care to try and give people real genuine alternatives to coming into hospital, because what we'd like to do is to see the highest proportion, particularly at the Northumbria, of the most critically ill patients.
So what message would you give to patients directly then listening today?
Yeah, so I think we are open for business, and we are there to treat people who are seriously unwell, and we absolutely are welcoming patients who want to come and see and be assessed by us. However, if you're not seriously ill, there are alternatives that you can either access through your primary care doctor, through NHS 111, who will direct you to the best locations, and we're working with those all of the time to give you safe alternatives that are nearer your home, to try and have you seen and assessed as quickly as possible.
That's great. Finally, where do you hope to see yourself after year 2?
Oh, well, of course, I think to be the most popular hospital in the North East is a good thing, so I don't want that to change. But I would like to see us to have the capacity and to be working much more closely with North East Ambulance, who will also have the capacity to solve their staffing problems, so that we can manage the demand that we have from our population in the North East. I'd just like to point out we have more outstanding hospitals in the North East of England than any part of the country, and that success is part of our problem, because actually we give a great service.